Good evening and welcome to Bronx Talk. As you might know, 2023 is BronxNet's 30th anniversary. So to help celebrate as the borough's first ever talk show, we here on Bronx Talk have put together some legacy editions of Bronx Talk. We've already done a show with two nonprofits that have served the borough for decades. For the next 2 weeks after tonight, we're going to work with Bronx environmental groups and Bronx artists who have been with us for decades. But tonight, we're going to take a look at a hard reality that also has been part of the Bronx landscape through BronxNet's 30 years, and that is the need for harm reduction from drugs. According to a report by the state controller, the Bronx's drug overdose rate has surged to third highest in the state over the last 10 years. But the good news is that there are organizations in the Bronx that, with their innovative, comprehensive approach to harm reduction, they've saved thousands of lives, literally. Tonight, we'll meet with two of them to define their approach and help explain why these excellent organizations have been leaders in the fight through heroin and AIDS, the crack epidemic, and now in this challenging time of fentanyl and opioids. Please join me in welcoming from St. Anne's Corner of Harm Reduction, CEO and founder Joyce Rivera. Ms. Rivera, nice to have you.
A pleasure to be here.
And from VIP Community Services, its president and CEO, Debbian Fletcher-Blake. Ms. Fletcher-Blake, nice to have you.
Pleasure to be here.
Thank you.
You know,
we were just talking beforehand about how long you guys have been around. I was not fully aware that VIP has been around since the 70s. So that even predates, the crack epidemic and maybe even some of the heroin epidemic I was talking about. Let's just go back to the 70s, explain what was going on in the Bronx at the time and who created VIP and what it was intended to do.
Certainly. So VIP was founded in 1974, as you said, actually on April 1st. So it's, all fools. But it was...
We're no fools here in the Bronx. You know what you're doing.
Thank you. It was created during the time of the burning Bronx, when there was quite a bit of drug use, similar to what it is now. And people had very little resources or very little outlet for providing services and receiving services. And so Father Bonomi, in a church basement, founded VIP.
Wow.
And it was founded more of a harm reduction model, where people were provided services and an opportunity for jobs. So hence the name Vocational Instruction Project.
I was going to say, VIP sounds like a very important person, but that's not the original idea.
No.
Even though it kind of resonates nicely now.
Yeah, it does. The idea was to provide jobs and job security to families and put people out to work. And that would help them to build the resources they need.
So he understood, and this is, of course, philosophical through both of your organizations. He understood that if you say, okay, whether it be methadone or whatever you deal with when you deal specifically with drug addiction, it was a larger issue than just that.
Absolutely. He realized that the structure and the economy and the social issues were all compounding drug use. And
it was very interesting to me because I didn't think you were going to say this. You said it's very similar to today. We'll get into this with both of you, but what is the similarity and what is the difference? Or is there really no difference? The job is the same?
Well, the similarity is that drug use is still a problem in the Bronx, right? The Bronx is the leader of overdose deaths occur in the Bronx among New York City, and it's the third in New York State. So the problem is the same. Joblessness is the same. The Bronx ranks number 62 of 62 in counties in the state in health outcomes.
We certainly know that. We've repeated that, unfortunately, way too many times.
Right.
And so the philosophy in plain language, deal with that first, and then you can still work with the others. All right, Ms. Rivera, let's just talk about St. Anne's Corner of Harm Reduction. Now, you came aboard a little bit later, but you are the founder. What did you see that made you say, we ought to do something?
We weren't doing anything about injection-related AIDS. We were just letting people die. That's a plain fact, nationally and statewide and locally.
Certainly here in the Bronx.
Oh, certainly in the nation. And New York has always had the highest number of opioid users. We were just basically letting them die. New York State only had around, New York City had 33,000 methadone slots for 250,000 drug users.
Wow.
So we had an HIV epidemic that had been brewing since the 70s, quietly lurking. When VIP started, HIV was already in our bloodstream, social bloodstream.
It's fascinating to me because it really is central to Bronx history. The Bronx was burning. There were no resources of any sort. In your case, the Bronx wasn't directly burning, but in your case, the whole idea was drug use is now leading to this horrible virus and disease.
Well, the Bronx had sort of always been of the 5 boroughs, the forgotten borough. I mean, it's sort of been allowed to sort of flounder and die on the vine. So after the 1975 fiscal crisis, when New York City was, the budget was cut by 40%, it hit hard. It hit the clinics, it hit jobs, it hit working class people very hard. So we had we had squalor. The Bronx was being allowed to fall apart.
Sure.
And so no jobs, no hope.
And so for you at St. Anne's, what did you say? Now, so the thing was to stop needle users from sharing needles and
Correct.
Getting AIDS. What did you do, and what was your vision?
Well,
of
I was a drug researcher, and so I knew the data firsthand, and I brought that to bear in my work. I was connected to researchers across the country and across the globe, and it was clear that providing access to syringes was the way to prevent the transmission of HIV, of injection-related HIV. So I did that work in the community that I was working with.
I looked it up because I remembered it. First of all, by the way, folks, this is Substance Abuse Awareness Month. I mean, it should be every month, but I guess that's what they've designated October. We started BronxTalk in the fall in October of 1994, and we were always looking for things that were really happening. And the first time we did needle exchange was soon after. I looked it up. It was January 17th, 1995, with New York harm reduction educators. We did needle exchanges. Let's start there. Did it work? Does it work? Where are we at? Can we still do needle exchanges? I know that there's a lot of controversy over it. There are many places where they say this is a stupid idea. You're giving drug users needles. Where is the needle exchange part of it at?
Well, it's highly successful. It's just pragmatic and successful. We used to have 65% of injecting drug users who are HIV positive. That's less than 3% now. That's a significant, it's the only behavioral intervention that really works. There is no other intervention that is quite as effective and quite as, less harmful to the community.
How do you, now listen, you give them needles and okay, so they won't infect each other and we stop the flow of HIV through that. How do you then go from there to helping people not need needles and get off drugs? Like, what's that process? Does it help you identify drug users because you do that? Or, of course, nobody wants to give you their name, I guess.
Well, You know what? I mean, we're a drug-consuming nation. Just let's realize that we are the largest drug-consuming nation that has ever existed. And so maybe we need to find a way of owning that, which is what we in harm reduction do, and finding ways as civil society to protect all of our citizens across all age groups, across all demographics, because you wake up one day when you're trying to deny it and find out that you have an overdose epidemic. And you ask yourself, people ask themselves, how did that happen? Well, we created that, right? We have been hiding and shaming and using outmoded methods to really repress it rather than letting it shine so that we can put some light on it and find out how we can better help families, our families. You know, that's what a good civil society does, right? I mean, we protect the whole.
If you look at network television and examine the commercials that are on network television, they're all for different kinds of medications, ones I've never heard of. We all have something wrong with us, and they're trying to sell us some pharmaceutical product, which may or may not help. I'm not going to judge that. At VIP, I made a list. Let's see, housing and shelter, vocational services, behavioral and mental health services, ophthalmology services, which I thought was fascinating.
That's cool.
Primary medical care, and other kinds of health care. How does that work? Somebody comes in, they say, well, I've got a drug problem, or you identify that they do. Do you bring them in and just say, well, go see a primary care physician? I mean, what's the process that you use to at least begin to shed light, as Ms. Rivera said?
Well, we have no wrong doors, right? So if someone comes in and all they're seeking is treatment for substance use disorder, then we will treat them for substance use disorder and engage them in other services as well. If someone comes in and they're looking for vocational services, we do a full assessment, and then we get an understanding of what their needs are and engagement. I think the most important thing in healthcare is how you engage people. You can't force people into accepting any services.
Just say no doesn't work.
It does not work. You cannot do that.
I just wanted to establish that, because these folks certainly believe that.
It does not work. You have to engage people. You have to have an environment where people feel comfortable and the services are what they need and meet their needs.
Do people come in and say, I need help with housing, but then you know that you identify that? And what brings them in to, and we should mention you have the new facilities, and in 2019
Correct.
You opened a gorgeous new facility. It used to be on Arthur Avenue, which I remember, but now you're on 177th Street.
176th Street.
76th Street, I was a block off. But how do you get people to walk through the door?
Well, it's...
Or you just open the door and they show up?
No, that doesn't happen. It's our reputation in the community. People can also call for appointments. People are referred to us from various organizations, such as Joyce's organization. We have lots of partnerships.
We should mention when they saw each other, they gave each other hugs, so they know each other pretty well.
Yeah, so basically there's a lot of referrals that come in. We have a large network. The Bronx DA's office refers people to us. Other elected officials refer people to us, et cetera.
Well, that's interesting. So do they use that as part of, they're talking about alternatives to incarceration. They say, well, if you go to visit VIP or St. Anne's, then there can be some leniency for your
Yeah, we had
conviction.
we had a program like that, and it was very successful, where the alternative to incarceration was people coming in and receiving services from us. And they needed to be with us for 2 services and sometimes 3, and a lot of those people remained in care.
Ms. Rivera, how difficult is it to really get the feeling that you've impacted somebody's life? That addiction is a very difficult thing. What are the challenges? Like, somebody sits in front of you or among your many counselors, and they say, goodness, we've given them health care, we've given them other services, we help them find housing, but yet they're still sticking that needle in their arm or using drugs.
Well, we lead with empathy, we practice mercy, and we provide safety. And as a result of that, it's the engagement. And in that engagement, we hear their stories, and we see the whole person. Our services are holistic. And we're not focusing on their addiction. per se. We're focusing on extending dignity, recognizing their dignity and recognizing their value and our shared humanity. And I tell you, we're very successful with that. We've worked with over 35,000 individuals, and some of those folks have important positions now. They return back to work. Reintegration is the fifth pillar of our five pillars.
Do they come back to you years later and say, gee, I feel like I'm falling?
I have lots of letters, and I have people return for many reasons. Sometimes, it's because of the dependency. Other times it's to share their success stories. But every day that we hear them and see them, we leave the job with with a sense of the whole picture. And it is sad, and it is also beautiful because we get to hear them and extend to them a meal, extend to them acupuncture. We learn about their lives. We're very present in their lives. We provide them with breakfast and lunch and dinner.
Is individual care, in other words, one-on-one counseling, or group care, or a combination? And how do you determine who should get what? Or is there a program that everybody comes in and gets? Or is somebody assessed and then you decide this person needs this?
We view the agency as a therapeutic milieu. Mm-hmm. And so we establish therapeutic alliances with folks in whatever situation. I mean, we don't wait in our offices waiting for them. Our setup in the organization is that people have free access to everyone. And so if we meet them in the hallway or while they're eating, it's an opportunity, or in the streets, because we bring our services to the street. We're still at our first site after 33 years. We're still delivering services out on 139.
Let's put out the address so people will know where it is.
So we're at 139th and St. Anne's, and we're our other outreach locations. We're at Echo Park. We are in Highbridge, but our main location is at 100 in the hub. But our main location is at 886 Westchester Avenue. And people, of course, we have vans and we drive around. We go to where the stroll is. We go where the services are needed. And that's really important.
I remember
we're reliable,
There used to be those that's when we did it way back in the 90s, a needle exchange van, that would move around. But this is the perfect segue to your mobile unit. Why don't you talk? I know that VIP is very proud of what it's done. We have some pictures we're going to show. What is the mobile unit? What is that all about?
So it's a mobile medication unit that we recently purchased, and it's getting ready to be launched on the street any minute now. Right. It is a methadone clinic on wheels. We've got
pictures of it that people can see. Go ahead.
Yeah, it's a methadone clinic on wheels. So we'll take it into areas where people don't have access to methadone, and we will provide methadone medication for them right there where they are.
One thing which I was frankly blown away, and we see some of the photographs, you really did a great job with this. This came through federal funding, and you, rather than me say, who walks through the door, this is a way of reaching them where they are.
Absolutely. And, this was funded by OASIS, or a state agency, through the federal government, of course. And the support that we've gotten from OASIS is tremendous. And anyone can walk to the door. We're taking services to people where they are. And that is the way that services ought to be delivered for people with a chronic illness called
It's not ready yet, but it's going to be ready.
It's going to be ready. We are waiting for final approval from the federal government right now.
Do they Gary gets a vote? So I see it's going. They never ask. One other thing I wanted to ask you, which was very interesting to me to learn that you are a practitioner. You're a nurse practitioner, and you have extensive background in that. Does that play at all in your evaluation of what you're delivering to clientele?
Every day.
Every day.
I'm a family nurse practitioner, and I bring that to every decision that I make, because I understand that substance use disorder and any other illness that comes in the door is probably a chronic illness. If it's an acute illness, we'll treat it as such, but the majority of the patients that we see have chronic illnesses. And so when I think about substance use disorder, I'm always thinking of, okay, how do I treat chronic illnesses? And what do people need to keep them?
This is really a core issue. And then for you, a similar kind of question. I'm still wrestling with kind of the technical aspect versus, kind of the holistic aspect. You have to have trained people. Do you have a lot of people who work for you who used to be drug users? I know with gangs and violence, they try to have formerly, incarcerated and other people to talk to people. Do you find that the best advice they get may be from peers or former peers, so to speak?
We have about 50, 55 employees, and a significant number of them have substance use histories. Absolutely. Nothing without, the mental health dictum, nothing about us without us. So that holds true, I think, in all fields, and certainly in our field.
Is there an understated commentary about healthcare? Because healthcare is the largest industry in the Bronx, and yet we're talking about people who need healthcare are going to harm reduction services. Seems to me that you've got to set up, and both of you have got to set up like a little hospital to some degree, or an outpatient service provider
indeed.
like CityMD or something.
We have a drug user health hub, so we prescribe buprenorphine in the office and by outside as well in our van. But look, a lot of our people have Medicaid cards, are eligible for Medicaid, but they have poor health care. It is, they go to get health care.
That doesn't balance.
So imagine that we know that they have Medicaid, and yet they're in poor shape. They have very bad health experiences. So we need to look at that and understand why it is that this group of people experience the healthcare system in such a, in a negative way. Now, notably, there are exceptions, of course, and we work with a lot of those exceptions. But in general, the poor are treated differently, and the stigma drives people away from services. The stigma of using will stop a woman from getting services, reproductive health services. So we incorporate that in our office. The stigma of getting an HIV test positive drives people from those localities. So we provide that. So we find ourselves expanding services precisely because there are such barriers to care.
Well, that's what I was suggesting. I'm just curious, we'll start with you, I'll ask you both. The effect of the pandemic, this was a challenge for all of us in just about every way. Did it change what you have to do? Did it make issues worse? Were there more people? I don't want to put words in your mouth, I'm just curious.
The impact was severe isolation. We were open the entire time. We switched our methods to grab and go. We provided more food than ever. We gave over 35,000 meals in 1 year.
That was all over the Bronx, certainly other places
food insecurity was impossible, and we did mental health services out in the street.
Really?
We abided by, if you pass our sidewalk, you'll see paint lines where people had to stand, about 3 feet away.
Are you past it? Now it's 2023. The pandemic started in 2020 and somewhat ended in 2022. Or is there still residual issues that you say, wow, that's really left over?
A lot of people were sent to different localities. Homeless people were shifted to other boroughs, other parts of the state. But we have need is need, and when you're providing the services,
you provide the service. So I'm curious about VIP. The pandemic had a big effect, or you just listen? We do the job. We do it every day.
It had a significant effect on us too. I mean, we had to pivot to a lot of things that we didn't do before. We stayed open the entire time to provide services to our patients and also to staff to keep them safe, right? So allowing staff to come to work versus living in crowded situations. We were in the community, in the homes of seniors, providing vaccinations. We stood up vaccination hubs on the streets and elsewhere to provide vaccinations for children and adults. We started telehealth at a larger extent. We were doing some before, but now we do a lot of it. There's a lot of social isolation. You know, like Joyce, we provided food, a lot of transportation. We were able to put some of our patients in hotels to hotel them when they came down with COVID, especially patients.
That was we actually did a show, a segment on that on my other program, but that was a service the city provided, which was very smart, using empty hotels as you know, hospitals, whatever. I'm just curious. I suppose I have to ask this. Migrants. Do you deal with migrants? Has that changed anything for you? Of course, those folks may not easily get a job. They, you know, the vocational services go in one ear and out the other because right now they're not licensed to work. And then, of course, they may not have a Medicaid card at the time.
Absolutely, all the above. So we are currently operating about 4 sanctuary sites. We have over 1,000 migrants in our care.
Wow.
Over 3,000 actually, including children.
Do they have drug issues, or that's not? They have issues, but not that one.
Well, they have a combination of issues. I wouldn't say drug issues are the predominant. There's a lot of domestic violence. There's a lot of abuse that they have encountered previously.
Endured, yeah. So that needs counseling. Listen, congratulations for doing that, because the harm reduction has been the theme, but yet you provide those services.
Well, harm reduction is across the continuum, right? There are various levels of harm reduction.
Before we run, I just want to ask you about migrants. Does it come across your desk or through the doors?
We don't have Medicaid, so we allow everyone in. I mean, you could just walk in. You don't turn anybody away. We don't turn anybody away. No wrong door, and we have very poor Hispanic people who come to us, and we shy away from being very intrusive about who you are, just to make sure
to deal with what's in front of you. Listen, we're just about out of time. I want to give you both an opportunity to tell people where to turn. How do they get to you over at St. Anne's Corner of Harm Reduction?
St. Anne's Corner of Harm Reduction is located at 886 Westchester Avenue, and you could take the number 4 train or the number 2 or the number 5 to Prospect Avenue. But you can reach us on the web at www.
We just put it up on the screen. Okay. They can go to the website. If they pick up the phone, somebody will talk to them.
Absolutely.
It'll not be, hey, we'll get back to you in an hour.
Always.
And what about, how do they get to VIP?
And VIP, we are located at 770 East 176th Street, website or the phone, and we are always available 24/7. And we'll also go out and get you if you need to come to us.
There you go. Listen,
Same here.
Joyce Rivera, CEO and founder of St. Anne's Corner of Harm Reduction, thank you. And Debbian Fletcher-Blake, CEO of VIP Community Services, thank you. Folks, if you want to see heroes in the Bronx, right here.
Thank you, Gary.
Thank you,
Thank you very much for everything that you do for all of us, for your commitment, and really for taking this kind of view of a very difficult issue or issues. Okay? Appreciate you coming to the show. We thank our producer, Rebecca Hemick, our director, Will Guzman, the cast of thousands who work with us here in the studio, and of course to you, the people of the Bronx. Over the next couple of weeks, as I said at the beginning, we'll continue to help BronxNet celebrate its 30th anniversary with legacy shows featuring people like this who've been with us all these years. And we'll take a look at some of the individuals and organizations who've been part of the Bronx landscape for decades. So if the curtain don't fall and the creek don't rise, I'll be back. We'll see you next week. Good night.